Adults with Marfan syndrome have demonstrated increased biventricular volumes and decreased left ventricular ejection fraction, consistent with an intrinsic cardiomyopathy. The onset of cardiomyopathic changes and the prevalence of ventricular dilation and dysfunction in pediatric Marfan patients are not well defined. This study evaluated ventricular size and function in pediatric Marfan syndrome using cardiac magnetic resonance imaging. This retrospective cohort study examined Marfan patients less than 19 years of age at time of first CMR. Biventricular size and systolic function at initial and consecutive CMR studies were analyzed and compared against normative pediatric MRI values. An LVEF less than 55% was considered abnormal. Subgroups with varying degrees of LV volume loading were analyzed. A total of 31 subjects were studied, and across all degrees of LV volume loading, indices of LV volume were significantly increased when compared to published pediatric normative values at the time of initial CMR. Of the total 31 subjects, 19, or 61%, had absent or mild LV volume load. Absolute and index diastolic volume z-scores were greater than 2 in 47% and 53% respectively of those with absent or mild LV volume loading. Overall, across all LV volume loads, EF was abnormal in 42%, including in 53% of those with absent or mild LV volume loading. The top two box plots show that increased absolute and indexed LV diastolic and systolic volumes commonly had a z-score of greater than 2, represented by the dashed horizontal line. This was true even for patients without significant LV volume burden. The last box plot demonstrates that the distribution of LVEF values across the volume loading subgroups, notable for the amount of patients with an LVEF less than 55% in the absent and mild subgroups. Lastly, consecutive LV and diastolic volume z-scores seem stable over time. We concluded that LV dilation and dysfunction are common in pediatric Marfan syndrome and occur with absent and mild LV volume loading, supportive of an independent cardiomyopathy. This was also supported by dilated RV volumes in the absence of RV volume loading. Early dilation appears to be stable through adolescence, and aortic root z-scores demonstrated moderate positive correlation with end-diastolic biventricular volume z-scores, though further study is warranted to confirm this correlation.